For calcium to perform its major functions in the body, the blood calcium level needs to be in between 9 to 11 milligram per deciliter. Now, calcium is involved in a variety of different functions in the body. We'll discuss some of them briefly here, just the names of them. Calcium is involved in blood coagulation, muscle contraction, nerve conduction, release of neurotransmitters from the neuronal membrane, bone and teeth formation. It is also acting as a second messenger and also plays a role in maintaining the integrity and permeability of cell membrane. The role of calcium in the integrity and permeability of the cell membrane can be seen by the fact that when there is hypocalcemia, there is actually decreased level of calcium in the aqueous humor and increased sodium in the within the lens due to some problem with the permeability of the lens and thus leading to cataracts formation. Now, there are many conditions that are associated with decreased calcium blood levels, and it can lead to osteoporosis. Now, osteoporosis is a bone disorder that is associated with decreased bone mass. Now, it is decreased bone mass, but the bone to mineral ratio is normal. That means we have near normal bone, but not enough of it. It needs to be differentiated from osteomalacia and rickets. That is actually a bone disorder in which bone mineral to matrix ratio is lower, right? And when osteomalacia occurs in children, that's called rickets. Now, we know tetany is caused by hypocalcemia, in which there is overly stimulated nerves causing involuntary muscle cramps. Hypocalcemia can also cause chronic allergic skin conditions, and in some countries, actually, calcium preparations are used topically to cure itching, wheals, erythema, etc., but it is not really supported by some evidence. Now, to treat all these conditions or to prevent them, we actually use calcium preparations that can be given orally as well as parenterally. The oral calcium preparations include calcium gluconate, calcium citrate, calcium lactate, calcium carbonate. Now, of all of these, calcium carbonate is the most cheap, tasteless, and it is preferred because it also has increased calcium concentration in it. Among the parenteral calcium preparations, we have IV calcium gluconate. It is preferred because it has a non-irritant action, while IV calcium chloride is not preferred because it is highly irritant. Now let's quickly go through the uses of calcium preparations. They can be given in deficient patients such as in growing children, pregnancy, lactating women, and also in dietary deficiency of calcium. They can be given in postmenopausal women who are prone to osteoporosis because they have no estrogen. They can also be given after long-term corticosteroid therapy because we know corticosteroids have a anti-vitamin D action and they will lead to osteoporosis. Calcium preparations can also be used after parathyroidectomy because the body is as such used to the high levels of parathormone, and maybe the cause is because too much of the parathyroid tissue is removed and there is decreased parathyroid hormone leading to hypocalcemia. Lastly, they can also be used as antacids, chiefly calcium carbonate in GERD or peptic ulcer disease.